From the NewsChannel 5 network, this is Open Line.
Hello, everyone. Welcome to Open Line. Glad you are with us tonight. It is Tuesday, August 11th. We are talking about, once again, the coronavirus. Now, just this week, the legislature went into special session. One of the big issues being discussed is liability protections for businesses. Obviously, businesses say if they're going to reopen and get the economy going again, they need these protections. Now, there are other groups that say this more protects businesses and it does not protect employees. It would take away their ability to file lawsuits if there is wrongdoing against businesses, and there's some concern about that. This is one of the issues that will be debated in this legislative session, and it's what we want to delve into tonight and discuss. We are happy to have with us somebody who has a strong opinion about this and somebody who can help us learn more about it. Bradley Jackson, he is the CEO of the Tennessee Chamber of Commerce and Industry. He is joining us via Zoom, as all of our guests do now. Mr. Jackson, thank you for being here.
Thank you, Ben.
You're also a member of Governor Lee's Coronavirus Task Force and the Economic Recovery Group. So you have a lot going on. Let's talk about liability protection for businesses. Why, in your opinion, is this so important?
Sure. Well, first of all, thank you for having us. We greatly appreciate the opportunity to talk about this issue. Liability protections, whenever we survey a number of our businesses, it is absolutely one of their most important concerns. They are in fear of frivolous lawsuits during this pandemic. There's so much uncertainty. There's so many opportunities for people to make claims or allege things. So in order for them to fully recover, they want stability and they need it. Economic recovery is absolutely key for all of us, whether it's, your employment, if it's state and local tax revenue that businesses drive. We want economic recovery. We want to do it in a safe way. And we feel like the bill that Governor Lee has proposed and the legislature is considering is a balanced approach to it. So it'll make Tennessee, I believe there's about 6 or 7 other states that have adopted it, and we would be following them.
So this is a hotly contested issue. There's some who say the bill favors employers over employees. One person quoted here in the Tennessean, Odessa Kelly, said the bill will protect billion-dollar companies from lawsuits while leaving workers vulnerable. You said frivolous lawsuits. So let's say someone does get sick. Their employer tells them, you need to come into work, you're going to lose your job. They get sick. Is there any recourse here? I guess, does this remove any recourse from workers to file lawsuits against bad actors, employers?
Well, what it really gets to are instances of where individuals try to make a claim. The employment side of this is actually under wage and hour, and is a little bit different, especially when you look at TOSHA and the guidance that they have to do. This bill does not in any way prevent anyone from bringing a lawsuit. What it does is it creates a higher standard that if you're going to make an allegation, you're going to need to prove gross negligence. The other standard is kind of a negligence standard. So an individual can still bring suit. It's just what they have to prove is a little bit higher standard to be able to make sure a lawsuit goes forward. The one thing that businesses fear is we've all heard about it, or what's called sue and settle type situations, of where sometimes when someone makes an allegation, no matter how egregious or unsubstantiated, that business, in an effort to kind of make it go away, will just settle, even though they know they probably have a good case. So what this legislation does is it really avoids those type of situations and provides a lot of certainty around what you can bring and what's not. And I would add, this is not just focused on business. This actually covers any entity, any person. So churches, not-for-profits, critical healthcare institutions that have been out there on the front lines, protecting our communities and trying to help us, whether it's making goods and providing services. So for them, it's really crucial.
Nursing homes are a group that's concerned about this. And I believe part of the debate over this is over when these new protections should go into place, right? Should there be a grandfather clause? In other words, should this be retroactive going back all the way to when the coronavirus started? Or if you have already filed a lawsuit, say against a nursing home where you had a loved one die, you filed a lawsuit thinking that nursing home was negligent, and you filed it last month for something that happened shortly after the coronavirus started, would that lawsuit be impacted? Walk us through where those things stand right now.
Sure. So the original bill, which came out in the June legislative session, unfortunately, it was not, the legislature adjourned without passing it, adjourned on June the 19th. So Governor Lee reconvened legislative leaders and said, this is a priority to me. So one of the issues that we could not resolve was the retroactivity issue. A lot of employers say that I started taking actions on March the 5th, whenever the first case of coronavirus was cited in the United States, or I believe actually Tennessee. So the proposal that did not pass earlier went back to March the 5th and provided protections. There were a number of questions about that. A lot of people questioned the constitutionality of it. So what the revised bill has, it only has a retroactive date beginning on August the 3rd, which is when Governor Lee called the legislature into a special session to convene on the 10th. So this approach, it provides a little bit of retroactivity. And I will say, if someone has already filed a lawsuit, which a number of lawsuits have been filed out there regarding nursing homes, nothing will change at all about their lawsuit. There's no retroactivity. That lawsuit will move forward under the current law right now that we're under to protect those families and to provide some fairness.
That is what is in the current bill that is before the legislature, right? That it would not impact any lawsuit that's been filed already.
Right.
But this can be debated, right? Is there a push to include lawsuits that have already been filed, or is that off the table as far as you're concerned?
I feel like that issue has been thoroughly debated, and I feel like it's off the table. I think the agreement that everybody has really worked to achieve strikes a balance on this issue. So I feel like I don't think there's going to be a whole lot of debate around it, especially with it being kind of a more narrow time frame with the retroactivity. So it's kind of a middle of the road approach, if you would. And we really, Governor Lee and the legislature, it's a big deal to call a special session, and we really appreciate them in the midst of the pandemic calling everybody back to really work on this issue.
Critics have said that there are bigger issues in the midst of a pandemic that we should be focused on, that to call a special session for this is maybe not the most urgent issue. What do you say to that?
We think it is the most urgent issue right now for the business community. Now, Governor Lee has the authority to call a special session on any issue that he deems is appropriate, in agreement with legislative leadership. So this one has been called around the COVID liability reforms. If there are other issues that continue to progress or that need to be addressed, Governor Lee can always, recall those. When we look at what it takes to get our economy back up and running, and to make sure that we don't lose, over half of our small businesses, or that over time even mid-sized businesses start to not be able to make it. If there's things that we can do to protect that, we think it's vitally it's crucial, especially when you look at one issue about this is, businesses provide, we've seen states having budget issues, Nashville, businesses provide substantial tax revenue that funds our schools, that funds crucial services that we all need. So to get them back a sense of security, it's it's a small, move to make on behalf of the larger picture of where Tennessee needs to be.
Is there a particular business that's pushing this more than others? I would think nursing homes really want this. Food processing plants have been hard hit by this, and I don't know if they are pushing this. Maybe construction sites, another. Are there some industries that have really been that I guess you represent that may say something along the lines of, we can't operate unless we have this?
Yes, and the the Tennessee Chamber, when we started this, we have over 30 different trade associations that represent, a variety of groups, whether it's schools, higher education institutions, construction, grocery, pharmacists, who have signed on in support of this. And collectively, they employ about 2.3 million Tennesseans in all these different industries. So they have looked at the current pandemic, and they've heard from their members, their business owners, small, medium, and large, that this is a very important issue and one that we really need to work to get done. And the bill that we've got in front of us, we feel like it's a very fair bill. It doesn't tilt the scales of justice in any way. We think the legislature during a pandemic can make some decisions about things that they need to pass to ensure Tennessee's overall economic recovery and for the health of our state.
So this is important for businesses. At the same time, because businesses are going through a tough time, it's a scary time for businesses. It's also a very scary time for workers. And I'm reading this Tennessean article, so I credit the Tennessean article, but it says from March 1st through June 30th, TOSHA received 537 complaints from Tennessee workers alleging unsafe working conditions due to their employer's failure to abide by COVID-19 safety guidelines. So it's clear workers are scared as well. They're concerned about having to go into work, and they're concerned about catching the virus. How does this take away one of the means by which a worker can try and make an employer do the right thing? Does this make workers more vulnerable?
We do not think so, because in Tennessee we have a workers' compensation system that is a no-fault system, that when there is an injury at the workplace, if that employee can tie that to an incident that happened at the facility, then that will be covered. COVID will be covered under workers' compensation. Now, there's been some discussion, that's what makes this very tricky, is that COVID, being an airborne disease, it can be gotten anywhere at any time in any situation if you're not wearing, proper PPE. Identifying it that it exactly did happen at the workplace has been part of I think the confusion or the question. So, but there still have been workers' compensation claims. We can't see because of privacy, the individual awards, but there have been cases that have successfully been brought under workers' compensation to make workers whole. So once you have you bring a workers' compensation claim, it's a sole remedy. There's not other opportunities for you to go out there to try to find additional. And I'll say too that the TOSHA, that's been a big discussion. That's the United States Occupational Safety and Health Administration, and Tennessee has their arm. And I will say their guidance on this, they've produced a number of guidance, but their general duty clause kind of notes their purpose is to ensure that employers will furnish each worker employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm. So that's the guidance. If Congress wants to go in and allow TOSHA to govern infectious diseases, they certainly could do that. But right now, that's not TOSHA's sole objective. They can review these complaints and they can look at them, and then they can determine if the employer is at fault and there's substantial evidence, then that can move forward.
At this point, yes, 537 complaints, but TOSHA has not issued any citations. They say they cannot issue citations for complaints specifically related to the disease because there are no workplace standards at this point. Should the legislature in special session identify some specific standards that employers must live by? Would you support that?
So we would be willing to look at that and have a discussion around it. I will say TOSHA has ramped up whenever the pandemic first hit, and we're seeing this with everything. There's so many questions in state statute and local government, ordinances and rules with what they can and cannot do. Who has the authority to enforce masks? Under a state of emergency, what exactly can the governor do? There's so many questions. When you look at Tennessee having their own Tennessee OSHA here, the legislature likely does not have the authority. It's really a federal government issue to where they would need to come in and give TOSHA the authority to govern infectious diseases. And I think that's what OSHA is saying, is that we don't have that because it is an airborne infectious disease. It's very hard to tag it precisely, at that it occurred at the employment, during the employment. So I think that's part of the challenge. But I will tell you, I feel like employers, we saw this immediately whenever Governor Lee issued the stay-at-home order. There were a number of essential employees that helped tremendously. They stepped up, they did their jobs, and our employers appreciate that so much. And the infection rates at that time, they all dropped. So the issue of spreading has really not ever been tied to solely employment. It really is when stay-at-home orders started to be eased and we saw group gatherings start to happen, and then we saw numbers start going up. So it's very difficult to attach it to a specific incident or time of when you would have gotten the disease.
I would say you could tie it to some food processing plants. You could tie it to nursing homes and possibly even some construction sites. And so if an employer works at a food processing plant, they go in and they get the disease, I guess that would be a concern for that employee. Would he's someone who is deemed an essential worker, and he is someone who is probably not making tons of money, needs his job to pay his rent, and is going in and totally reliant on that employer to provide a safe place. If he were to get sick and there's an outbreak at that plant, I guess that the concern would be that does that employee have any way to, I guess, sue the employer? And do you feel like he should, or you feel like he should not?
I would say that employee, under those situations that you outlined, there would be a likelihood that they could prove there was gross neglect or willful misconduct that would allow their suit to move forward. Any court, they're going to look at the patterns, the facts of any situation. And clearly, if there was that kind of transmission with COVID at an individual employment place or location, that likely would be gross misconduct, and therefore the business would be liable for that. So the proposed legislation no way locks anyone out of the courtroom. It just raises the bar, because there's a lot of cases out there that employers have given us. One of our small business owners said the other day, you have to have a mask when you come in here, and an individual agreed to do that. And then as soon as they entered, they took the mask off. Now, the employer then is in a very difficult situation. Do they ask that person to leave and try to enforce the ordinance? What if somebody else comes in and says, you weren't following Davidson County's guidelines, and I contracted the coronavirus, and it's your fault? Is it that employer's fault that that individual who was, invited onto the premises took their mask off? So there's a lot of very difficult scenarios to kind of walk through, especially during a pandemic. And this bill really tries to provide some certainty around it so that everyone knows these are kind of the rules that you're going to have going forward on these types of cases.
Well, now that's interesting, because I've been looking at it from the employee standpoint, and now you're bringing up also a customer. So a customer could come into a restaurant, I guess, and if they got the coronavirus, there was some outbreak and there were a few waiters who were sick or something, I guess that would take away or reduce their ability to sue. There's concern, I guess, about customers suing, not just employees. Is that right?
Yeah. And one scenario that's been brought up to us was, two individuals were at a restaurant, had a dinner. Their, server was wearing, PPE, had their mask on. They were notified 2 days later that their server, they need to go get tested for COVID because the server had COVID. So they asked questions about, when did the individual get it? And basically the individual said, I picked up my friend, coming out of the hospital, and then further disclosed that the individual actually had been at a big house party, 3 to 4 days earlier. So is the employer, or should they be liable for things that, people do, because they try to follow to the best they can. They're trying to do temperature checks. They're asking employees, have you been around anyone, wear your PPE, we're working to provide it for you. So there's so much uncertainty out there in so many scenarios. But yes, this bill does also protect businesses on that side of the equation, really.
And then the idea of gross negligence. So I'll go back now to the employee point of view. Again, an employee at that food processing plant, they get sick, they have to have the job, they go into work, and then they get sick. The food processing plant is probably going to say, well, we've done everything we can, but this is just, it's the way it is. What you say, gross negligence? How is that spelled out, or is that just a term? I mean, do you spell out in this bill that will be debated exactly what is gross negligence?
It is. There's a long precedent that the courts have established over time for what defines gross negligence. It's basically a willful kind of disregard. And I'll give you an example. Obviously, we're not going to mention any names, but it was alleged that there was a business in Tennessee that had a posting on their building that said, "We do not require masks in here. Enter." That is clearly a situation where it's they are disregarding, grossly being negligent to their employees and even customers' health by doing things like that. So the courts have long established what this is and determining kind of the proximate cause to these events. So there will be, I think a lot of questions about it, as always, that comes up with each individual case. But the courts over time have really, and I think in Tennessee, done a very fair job of kind of establishing those parameters.
At this point, have you seen an onslaught of lawsuits?
We track it. We have seen that so far to date, and this is across America, but there have been 462 lawsuits that have been filed in a number of areas that relate directly to COVID. So that could be invitees or people making allegations. So they are picking up. And also, we see there's advertisements now of where, if you feel like you've been harmed, if you think you've been harmed, call us now. So there is an opportunity, we think, for the legislature to go in and provide some parameters around this so that everybody kind of knows, the field that's going to be the standard for if you're going to bring one of these claims, if you're going to, to prove that they're grossly negligent. So, yes. Were there
sporting events that want this? I don't know, the Tennessee Titans. Is this something that would be important to them, or any other kind of large venue where large numbers of people may gather?
Well, for us, the Tennessee Titans have not, directly given us a response to that, so I can't tell you. You'd have to ask them. But I can say the coalition that we've got is extremely broad. I don't know that we have, any individuals who are solely supporting for sports, sports venues or reasons of that. But I will say that, businesses, I feel like, have done a really good job at looking at CDC guidance and WHO guidance regarding kind of mass gatherings and those type of events, and following those protocols. We saw up at Bristol, everybody kind of held their breath to see how Bristol would go when they opened up probably a quarter of the total space they have available there. And I saw a report the other day that there have been no COVID, contractions that have been linked directly to that. So, following the rules and them carefully going through this guidance is very important, and it does pay off. And I know all of our institutions are committed to doing that.
All right, we're going to take a break. That kind of sets the table for the discussion. And now it's your turn. If you want to call in with questions, comments, whatever, go ahead, give us a call. There's the number on the bottom of the screen right there, 615-737-PLUS, 615-737-7587. We will take a break. Be back right after this.